Hey everybody, welcome to Spine and Sports Therapy Kingwood, your one-stop shop for all things sports medicine, injury prevention. My name is Dr. Matthew Brackney, and we're going to be diving into a topic today about risk factors, or what I like to call check engine lights. Risk factors are the little messages that your body begins to tell you before an injury happens. Now, this is huge for preventing injury, which is one of our main focuses here at Spine and Sports Therapy. So like I said, I got a board here. Today we're going to be specifically talking about internal risk factors. In general, we kind of break down internal versus external risk factors. Today we're going over the ones that are internal, i.e. the things going on inside your body. Now, these things, like I mentioned, take place before an injury happens. My goal here today with this topic is to, by the end of it, help you to understand what it is your body is communicating you, and then what your next step is to try to mitigate it and prevent an injury. So we're going to jump right in. We have three major topics we're going to go over. We're going to briefly hit each one. Feel free to check out some of the other videos on our channel here that dive in deeper into each one of these to figure out what you can do best for each one. But we're going to, like I mentioned, briefly go over each one, give you an overview of these different type of risk factors or check engine lights to help you understand what they are, and then secondly, help you to figure out what your next step is. So we'll jump right in. Right here on this right-hand column, the first one up is muscle dysfunction. I didn't write dysfunction out, but muscle dysfunction, joint dysfunction, nerve impingement, and leg length issues. So muscle dysfunction, there's several things that fall into that category, like knots, trigger points, fascial adhesions, muscle overcompensations. These are things where your muscle is starting to break down. It's starting to not work well. It can cause pain, it can cause tenderness in muscles, excessive tightness, prolonged tightness, more than normal post-workout type of tightness. These are types of things that happen when you have muscle dysfunction. Joint dysfunction, this is when a joint starts to not glide well. Some of the common symptoms of that are clicking, popping, grinding, something that's unusual clicking, popping, grinding, one-sided clicking, popping, grinding. These are types of things that your joints will start to tell you if it's not moving right, not working right. Nerve impingement, common symptoms for nerve impingement are numbness, tingling, shooting electric shock-like pain. So those are types of check engine lights that you might feel with nerve impingement. Leg length issues. This is harder for you to appreciate sometimes, but oftentimes if you have to always sit when you're standing, you always put all your weight onto one hip. Sometimes leg length issues, you'll fall into what's called the shorter leg. Now, all of these first four, these ones are tough to handle on your own. There are some occasions where you can take care of them on your own, but most of the time, these require seeing a really good sports doctor to help out. Someone that focuses on functional therapy, sports medicine, to help with these things. So someone like a good sports medicine chiropractor, or a sports medicine physical therapist, athletic trainer, possibly an osteopath that focuses on physical medicine, stretching, joint work, and things like that. Those are the best types of people to help out with these issues. So we'll just put physical medicine there in this first category. This second category, these are a whole slew of things that are really good that you can take care of. These are all factors that you can control. We're going to go over the breathing. Breathing is huge. Having the right type of breathing. Make sure you're breathing most with your diaphragm and less with your chest. Less with the chest breathing. Balance. Balance is another one that often gets underappreciated, especially in training. Oftentimes we'll train for maybe a marathon or a weightlifting competition, but we'll leave out balance. And balance is so huge. Postures. There are three common postures that most of us spend our time in. Sitting, sleeping, and standing. Fixing those three postures can pay huge dividends in preventing injury, preventing muscle tension, joint tension, and can really go a long way in keeping you healthy and your body functioning at full capacity. Mobility, kind of another way to say flexibility. But mobility encompasses joints as well as muscles. Make sure your muscles and joints can go through healthy, functional motions. It's huge. Stability. Stability is really the prerequisite for strength. I kind of incorporate strength into this, but you need to have stability before you have strength. It's making sure that you're able to engage key core muscles that help keep your body stable when you go into physical activity. And then the second part of that is strength, is developing a base level of strength. And lastly, overtraining. Overtraining plagues a plethora of athletes. But a lot of people go into training too much, and they often suffer from it. There are some very easy to identify little check engine lights that overtraining might be having. Like, despite your increased volumes of training, your personal bests are going down. Your results are decreasing. Lack of joy with the activity that you're engaging in. If you love running and now you're just dreading it, the workouts that you're planning, you're just dreading them. Loss of sleep, things like that. Those are a few of the very common signs of overtraining, and that can really derail your performance in the long run. So, like I said, we have videos on every single one of these. We have a dedicated playlists to mobility and stability on the channel for you to check out. But these are all things that you can take care of. So all things that you can work on and you can fix. Lastly, in this category over here, we have some common clinical conditions, metabolic conditions, diabetes, for example, endocrine conditions like thyroid disorders, for example, autoimmune conditions like rheumatoid arthritis, for example. These are different clinical conditions that can definitely affect training and can definitely predispose you to injury. These three can affect your muscles and joints. So making sure that, one, you've been seen, you've been evaluated by your primary care provider, your primary care doctor, but also to be seen by either a clinical nutritionist or someone who specializes in functional medicine. These are doctors who specialize in chronic conditions like these, and particularly the nutrition aspect. If you have one of these three conditions and you're not addressing the nutritional component to them, you're missing a huge gap. So these three are important to address, important to check out by both, one, your primary care doctor, and then also someone who focuses on nutrition, whether that be a certified clinical nutritionist or whether that be a functional medicine doctor. But those are people who can really help you address a very key component with these issues. So we're going to put that here. We're going to put primary care and nutrition. So these are really, really key. So like I said, with all three of these, we kind of went over some of the basics that might help you identify if you might be having some of these risk factors. If you want to take a deeper dive into any one in particular, please check out some of our videos on these specific topics. But then also the next step for this first category is someone that is in the physical medicine realm, whether it be a sports chiropractor, sports physical therapist, athletic trainer, or possibly an osteopath that focuses on physical medicine. This middle category, these are all things that you can address. There's 1, 2, 3, 4, there's 6 things here easily that you can address to help decrease your risk for injury. And then lastly, these more clinical conditions, metabolic, endocrine, autoimmune, having one getting evaluated by a primary care doctor, but also having the nutrition aspect evaluated and how that is a component to those conditions. So that's it for today. Like I said, hope you guys learned something. Please feel free to check out our videos that take a deeper dive into each of these check engine lights or risk factors. Also, please subscribe to our channel. We have a ton of great videos on sports medicine, injury prevention, functional therapy, and all things like that. So hope that was good. Leave a comment if you have any comments. We'd love to hear from you. And thanks so much. Have a great day.